really the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hello, everybody. This is Dr. Natalie Keith.
Dr. Josiah Dame.
And this is Vet Tales. We are here for another episode. I gave Dr. Dame a couple of choices. I was really surprised at which topic he chose. I was debating between doing feline leukemia and FIV, which is, cats.
Coming up.
Stuff, coming up. We're like, let's research some stats in the area and get our game on for that. And so the other option I brought up to him was I feel like it's a really touchy subject because we were going to talk about money.
A little bit, yeah. And also treatment.
And treatment plans and how do we marry those two ideas together? Because, we all wish everything in veterinary medicine was free. And so we could just do whatever needed to be done without consideration of a financial impact. We don't as veterinarians as a whole, we don't really like to talk about money because it feels invasive, it feels confrontational, it can be a really sore subject, and there's a lot of misconceptions about it, and so can get emotions high, and we just like to skim over it, but unfortunately it is absolutely still a major part of what we have to deal with every day.
Yeah, and in veterinary school now, I don't know if the program was a thing when you were going through very short before.
It was a very brief decade. It just flew right by.
When I went through vet school, we had a whole communication course that lasted for 4 years. And a portion of that course was discussion of what affects your treatment plan. And there's, I think, because everything has points, I think there was 5 points, but, it's the dog's or cat's age, the owner's historical experience, and this is going to overlap a lot with our euthanasia.
I was going to say, that's starting to feel very Mary Gardner-y.
Yeah, and then one of them being financial, and our professor looked at us and she was like, don't let anyone tell you that finances don't affect your treatment plan, because it does. Even though you're about to go to an ivory tower where people are expecting to pay a lot of money, fourth year vet school in the university's hospital, people are coming expecting to spend a lot on diagnostics. When you get out there, know that that's going to be a factor.
Yeah, it 100% is a factor that causes us to change course at times, even with, the upcoming insurance. I think that's why I like insurance so much, is because I want to try to remove as much of that financial barrier between the pet and the client needs and wants, and achieving those things.
Yeah.
So that's, why insurance can be so critical.
And don't get it twisted. Sometimes the cheaper option that we end up going with works. Yeah. And sometimes the very most aggressive, expensive plan isn't a good one. Yeah.
It's not so that's, some points that Dr. Dame is making that you're considering. Another one that they threw in there was physical ability too. So for example,
I tell people all the time.
Yeah, we could take a couple of extremes on this and say, okay, well, what about a frisky cat who hides under the bed and scratches the owner every time they have to give them oral medications?
That's my cat.
Yeah.
Salem.
So sometimes it's worth the extra, $20 or whatever it is to go, depending on the size of the cat, to go to the injectable antibiotics so that you're not trying to give it antibiotics twice a day. And so it ends up being better for the pet and better for the client, but costs a little bit more. So, those are things, or let's say we have a dog that is 180-pound Great Dane with an osteosarcoma, and his owners are, in their late 60s, then doing an amputation for the osteosarcoma to delay metastasis, or, because that is standard of care. If you read the, not standard of care, it's a bad word for it, the gold standard treatment plan for osteosarcoma is an immediate amputation. Well, that might be a really bad idea for this dog, especially depending on which leg it's in, what shape are his other legs in, and things like that. So physical barriers are a huge one. And then I think for me, so this kind of came on because we had a client that was kind of misassigning intentions to us. And so it caused me to really go into a deep train about it.
Mm-hmm.
And I think the thing for me is that it's a balance between also, so we have what the pet needs, right? And the resources the client has, but I also have to support my staff here and keep the lights on and pay for the bills. And, our drug companies, a couple of them went up 7 to 9% on across the board on everything. And so we don't have a choice but to have that reflect in our costs. And is brutal. It's a brutal juggle as a business owner to feel like I cannot win on all fronts. Like I can't protect the business, provide for the staff, take care of the dog, and keep the bill, as low as possible. This is an impossible juggle. It will always be skewing one way or another depending on what decisions we end up making.
Mm-hmm.
And so anyway, so it's a heavy burden to bear, but I think my goal would be for us, for clients to have a better understanding of that background and our intentions in the recommendations we're making and the plans that we're offering, and plan B and C and D as needed, and why we're doing what we're doing.
Yeah. And personally, I always try to, unless it's a straightforward situation, I always try to give plan A, B, D.
Mm-hmm.
I just did that out of order.
Yeah,
A, B, C, D.
I was listening to a podcast this morning. She was like, so A, we have this concern. And then 2, I also have that concern. I was like, oh, I feel you. A and 2.
A and 2. So, well, yeah, A1, A2, B1, B2. With the, treatment plans and having multiple, which again, we've talked about before, those typically for me, going from gold standard is always going to be more expensive. It just sadly is. And then we can go down that line. And I think we talked about this, and this is a lot of overlap, but in the euthanasia discussion, none of those are wrong.
Yeah.
And if you, as I'm giving an option for a treatment, are like, let's talk about that. Can we open that discussion up? Is there anything else that we might be able to try? Yeah, I'll figure something out for your best situation if you have those concerns. And yeah, with I think what ends up costing a lot, and kind of the background of as a veterinarian why we're asking to do those things, is diagnostics.
Yeah.
I just want to know what's going on so that I can best treat your pet.
Right.
So that I don't personally, I always have the concern of, if I don't know exactly what's going on, which we don't always find out, obviously.
Yeah.
But I'm worried
rule out big scary things.
Yeah, exactly. I'm worried I'm going to treat inappropriately and then potentially cause harm. Yeah. Which is not what I want to do ever.
Well, yeah, it's a couple of really good examples of that where it's kind of a routine, basic thing, but we want to do some, relatively minimal diagnostics to make sure we're taking the right choices. It would be like bladder infections or ear infections, or I should say suspected, because a lot of times people will think their dog has a bladder infection and it actually just has inflammation. And so improper use of antibiotics creates resistance. And so I guess you could add a 5th balancing beam in here and say, the industry, like pet welfare or animal welfare or human planetary welfare as a whole depends a lot on the choices we make. And ear infections as well, because we have different choices of medications that we use for different types of infections. I had one yesterday or the day before, and the owner thought the dog had an ear infection, but it didn't. And so we didn't actually have
too.
Yeah. So they caught it at the inflammation stage because they were listening to the podcast, shout out Julie, and knew the early signs. And so we actually caught it before an infection existed. And so, that's your best case scenario. And then your worst case scenario is when you have a dog that's had chronic ear issues and the owner just keeps applying a random topical over and over again, or uses half the prescription when you send it home the first time and the other half later. And you're just creating resistance either in that dog or in bacteria as a whole. That's why some of our medications that we've had for a long time don't work like they used to because of improper usage. So doing something like a urine we don't even have to do cultures. You can just do
Urinalysis.
a urinalysis where you're looking for bacteria on there. And the same for ears. We're just doing a basic cytology. Do we have rods? Do we have yeast? Do we have bacteria? All three. We have a whole podcast on that and why we're making those choices.
Another one is like a coughing dog.
Yeah.
Can we not take the x-ray? Yes. And can I send home an antibiotic? Yes. But then you get that fear that, okay, well, is this bacterial or, is there a fungal component? And
fungals are the scary.
Those x-rays would help now.
Or congestive heart failure or collapsing trachea or, the list.
Yeah. So it's to help kind of delineate between those potentials and help us make the best informed decision.
Really, it's about like risk reduction, because I think, we have seen the best of the best and the worst of the worst. And so, I like to use the analogy of, you can drive down the road without your seatbelt a gajillion times and get away with it. But the highway patrolmen out there, the people seeing the ones that didn't get away with it and were horribly injured or died because that they weren't wearing their seatbelt when they had a wreck. And so it's the same thing. Like, you maybe didn't do heartworm prevention on your dogs and got away with it the last 3 times, but I treated 15 dogs for heartworms this month.
Yeah.
And so I think a lot of what we do and what we're deciding is because we realize where this can lead to and we want to cut it off at the pass.
And probably pulling back the curtain. Natalie has brought this up before in podcasts, but I am not the 15-year veterinarian. And so a lot of things I wouldn't say I'm fearful or anxious. Well, I am anxious, but I wouldn't say I'm fearful, like in general, but I have a level of, I want to make sure I am doing my absolute best at all times. That having that additional information through diagnostics, though they do cost more money, make me more comfortable that I am doing what's for your pet, which we've already kind of talked about. But and so now kind of to backpedal a little bit, if we don't do those diagnostics, that is fine. And I think that's another thing that we need to talk about. There's some where I will be like, no, like I'm going to twist your arm until we do that diagnostic. But then there's going to be other things where I'm going to go, that's fine. Like we'll treat, come back in a day or two if we're not doing better. Commonly, I feel like that is going to be the vomiting dog, where some
or diarrhea,
where, we're commonly just going to treat that patient. Now, if you're a 2-year-old golden who's vomiting 5-7 times in one day, I'm going to be like, no, we have to take an x-ray. But if it was a couple vomits and I'm like, hey, I'm going to offer this x-ray today, and you are like, let's just try to treat it like a gastritis, which means inflammation of the stomach. Great, we'll do that. But if we vomit tonight, you're going to be back here tomorrow morning.
Which is, it's so common. We do it all the time like that. So as long as we feel like we're not causing more harm than good, then we're totally fine with that situation. Back to a situation where you're afraid it might be a fungal pneumonia. It's like, okay, well, we can treat medically and see how things go, but I'm not going to give your pet a steroid just in case it's fungal, because I could make it worse and I don't know that it isn't fungal. So we work with what we do and don't know. Another great example, we have a little puppy that just came in yesterday and had a pretty nasty infection going on, and it was just a really weird random situation and kind of just popped up out of nowhere and wasn't really on the radar, and a really unique case. I actually haven't seen anything quite like it before, but
either.
The owner had a lot of other slices of the pie that were causing him grief, and he was limited financially what we could do at the time. And I said, I totally get that. In fact, what we can do, because diagnostics are one of the biggest chunks of money that we end up spending. And I was like, okay, here's what we do know. Here's what we don't know. Here's what I'm going to assume based off of what we're finding. Let's not, we do need to run a parvo test because that will radically change treatment plan, which was negative.
And where we house them.
Where we house them for, isolation purposes and so forth. So we did do that, but I said, let's not run the blood work. Let's assume he's septic. Let's assume everything else is functioning fine, and let's put your money towards treatment.
Yeah.
And I said, as long as you're okay knowing that I am making some assumptions, I am perfectly fine doing that, because I feel reasonably confident that I'm still going to make all the right choices to give him the best shot.
Yeah.
healing. And that puppy looks so good today.
Mm-hmm.
He's not 100%, but I guarantee you 75% better than he was yesterday.
Mm-hmm.
Because the owner was willing to be kind of flexible with this, and he understood we could do these other tests to gain more information, but due to the finances that we're working with today, let's divert our funds towards treatment.
Yeah. Yeah. Which is totally appropriate.
It's totally appropriate. Yeah.
And then there's that one test that we have to be like, this one we have to do, but the other ones, let's just.
Exactly. Yeah. So it's like we, for example, did not run a fecal on him to find out if he has worms contributing to his diarrhea problem, because I'm just going to deworm him.
Yeah.
He needs a dewormer anyway. Dewormer is cheap, easy, and safe.
Mm-hmm.
Let's just give him one. Let's not waste the money on the fecal.
Yeah.
Now, that's not a great long-term herd health management plan. But for this puppy in this moment at that time, he is the only puppy in the house. So that changes things too, because if he had several housemates, then we need to know if worms are a problem.
Mm-hmm.
But he is the only puppy. So just deworm him and we move on.
Yep.
And that saves us our fecal diagnostic cost and so forth. So it's the weird
gray.
It's
a gray area.
Yeah, it's exhausting mentally to try again to juggle this balance between all these competing needs.
Yep. And I would not do that if, I'm thinking of all of the hookworm dogs that we had this summer that were extremely anemic, even though they had been dewormed multiple times. Like that, not skipping the fecal is not necessarily an option for us, but in those moments, it has to be.
Yeah. Because that is.
Because if they have hookworms and they're anemic, bam, that's anemic, meaning don't have a lot of red blood cells.
That's because the hookworms drank it.
Yeah.
And then there's a lot of hookworm resistance. Mm-hmm. Now, this particular puppy wasn't pale. Mm-hmm. So it wasn't a huge thing on my radar at the time. Now, if he becomes pale over time or he's still having yucky diarrhea or we're, seeing other symptoms, then we'll circle back on that fecal. Yep. But right now it was, get him hydrated, get him on antibiotics, and get this infection under control.
Yeah.
So it's complicated, it's emotionally tolling, I think too, because we're trying to keep everyone's best interests at front of mind, which is a lot to balance. So anyway, yeah. I think the other really big point I wanted to make is that, we're not judging people if they cannot do what they wish they could do. We have, first of all, if there's something you want to do for your pet, we will seek high and low for ways to figure out how to make that happen. And it doesn't bother us a bit to do it. If you're in the battle, we're in it with you. It's sort of how I see it. And so, if you're ever in that position where you want to do something and you can't financially or physically or emotionally or whatever, we're just going to meet you where you're at and help you reach your ultimate goal, whatever that might be. We're helping you by helping your pet and giving you the information you need. So, and for all the clients that tell us thank you for that, that goes so far with this because we get a lot of hate on it. I got a couple of pretty nasty verbal attacks this last couple of weeks about, people saying we only care about money or, I can't believe you're going to let my pet die over finances. And it's like, no, we've provided you with so many options to, you've got to also put some skin in this game. But also, we haven't always been the best at being super thorough, I guess, in presenting like, okay, we need to use this medicine. This medicine costs $41.28. Sometimes we're just breaking like, here's your medicine. Yeah. And so, cause we forget sometimes.
To us, it's routine, but to somebody else, it might not be.
That's exactly what it is.
Justifying why we have to or are highly recommending something, because we're, seeing 5 ear dogs a day and 20 skin dogs a week or more, it's really easy to forget, okay, yes, this is why I was choosing this, and just to sit down and be like, this is why this antibiotic is what I'm
recommended in this situation. Yeah, because it does feel very routine to us at some point, and we forget that maybe it's not,
which is why you started this podcast too.
Absolutely,
because I've been able to it's tough. This is like an emotional podcast.
I know. That's why I didn't think he was going to pick this one.
It's tough when you have critical patients in the treatment room waiting on you, and you're consoling somebody in another room, and you run into a skin room, you're just as important in the skin room. And so your dog with a skin or ear infection, but it's tough when you're trying to work with more critical things to sit down and spend time with the people who are here for something simple in quotations like skin or ears. And
yeah, it's easy for us to just get kind of like glossing over that.
Which is why I'm glad you made this podcast, because I've been able to say, hey, I just sped through a whole 2-3 hour discussion with you about skin and ears. Here's the podcast card. Like, please listen to it.
Yeah, process this on your own time in your own space when you don't feel like you're just getting blasted with information.
Because it's a lot.
And sometimes we see, like, let's say, for example, you have 3 ear dogs in a day, which is not unusual. Sometimes I can't remember what I said to which. Did I say all the words to you, or did I just start and then stop, or did we skip the part about this? And I can't remember sometimes which parts of that discussion I've already had with the new person versus the last person. And it doesn't make it okay that we have forgotten to go over something, but certainly my hope is to at least explain our perspective on things, because I think if you can just like step into somebody else's shoes, even if you don't go the whole mile, it makes it a whole lot easier to recognize that we're on the same team together.
And for the justification of financial burdens that occur with those, because like ears can be financially burdened.
Yeah, which is why we are so aggressive about prevention on this. Like first ear infection, we're like, hey,
ready.
Here's what you need to get ready for, because we want to head these off at the pass.
Because you can use every ear medication in our building and still not get it to resolve, and
or it resolves and comes right back,
and then you have to talk about the food. So it's difficult. Yeah,
it is, especially because I think, for example, UTIs or ears are great examples where they look clinically the same. There's with a UTI dog or cat, we're straining to pee, there may be blood, right? Going out frequently or going to the litter box frequently. That looks the same as a non-bacterial cystitis, sterile
bladder stone.
Or a bladder stone.
Bladder cancer. They all look the same.
Gosh, bladder cancer. Mercy, help us. Yeah. And the ears, it's this, well, he had the same infection 2 months ago. Why do we need to do cytology again? Well, because we don't know what's growing in there this time.
I mean, I shake my fists when, not at the client, but at the ear cytology.
Yeah.
Because the client will come in 2 weeks before. It'll all be cocci, which are a bacteria, which go listen to the ear podcast. And then they'll come in for their 2-week recheck, and I'll look at the slide and it's all yeast. So I killed all the bacteria, but the yeast was like, haha, laughing at my treatment. And so I'm like, great, I'll see you back in 2 weeks. Here's a new medication because we've treated the bacteria. But then the yeast said, look at all this real estate.
It knows how I can move right on in.
Yeah. And then that's expensive. I mean, we get that. It is.
And it's frustrating for us too,
I would wish more than anything that I would not have to see ear dogs 3 times in a row. Yeah.
I wish it could, like the bladder infection dogs, at least you treat them and they behave themselves after that. You don't see these recurrent chronic, very rarely do you have dogs with chronic recurrent bladder infections.
But ears, it's like no joke. And I usually after the first recheck, when I do the cytology again and it's all messed up, I'll walk in and it'll be like, I don't want this to be the case either. I need you to know that I don't want to see you in 2 weeks, but you're gonna have to come back.
I tend to open mine with, I hope we're still friends after I tell you this.
I'm like,
you're not gonna like what I have to say.
Yeah.
I don't like it either.
And another one is like thyroid cats or thyroid dogs, where I have to have them come back to recheck their thyroid levels. I'm like, I'm so sorry, but it's like trying to turn the knob in a shower. It's just like you need to get it just lukewarm, and you're just too hot, too cold.
Yes.
And I'm like, I'm sorry, I don't want to see you either. I really don't. And I know this is expensive.
Yeah, at least the Libres. Man, if they could get like a thyroid Libre,
please.
That would be amazing.
It'll never happen.
It will never happen. It doesn't work like that, but because we had to jack that from human medicine anyway. Hypothyroidism in people isn't really a thing. Unless you have a thyroid cancer, maybe. I don't know. Even then, I feel like people get hypothyroid.
Yeah,
I don't know. I'm not a people doctor.
Me either.
But dogs are hypothyroid.
Yes, and cats are hyperthyroid.
Yeah, so different podcast. Yeah, we should definitely do hyperthyroidism in cat.
I want to do a endocrine podcast with hyperthyroid, hypothyroid. We need to split up Addison's and Cushing's. I just had an Addison's case. I think I'm waiting on the lab result.
Oh, yeah. There's no way that dog's not going to be Addison.
But,
and he responded so good to treatment in the meantime. So his name is also Max, just like my dog.
Yeah.
And we have another Max in hospital. It's a very common name.
You're like Big Max, Little Max.
My sister married a man named Max. So it's so fun when we're all like together and my dog is out in the backyard. I'm like, Max, get in here. And he's like, I'm like, sorry, in my head, they sound very different. It doesn't sound like I'm saying the same name in my head, but outside they sound very much alike. Max and Max. Anyway, all right, cool. So I guess it's a heavy topic. So at least we got a little bit of chuckles in today because it's something that I guess my hope is that
that is the water cooler, not a toilet. I need you to know.
Yeah.
I was like, did someone really just flush the toilet?
I'm hoping my background filter will take that sound out and then you'll just be wondering what we're talking about. But my hope, I guess, is that, we work heavily on remaining compassionate towards the humans that own these pets. Obviously compassion for pets comes pretty naturally for us, but compassion for the humans is, I think, what sets us apart here, or at least my heart in it and what I'm striving for us to have and to be is, very aware of our clients' needs and wants and struggles and to be with them in that space. And so my hope is that, somebody will hear this podcast or watch this on Facebook and extend us the same courtesy. And when they don't like the estimate that we're presenting or whatever, the cost of a surgery their dog has to have, just to remember that, it's not like we're, I drive a car that is old and
I've been in it.
Yeah, you've been in it. Yeah, she's a solid piece of equipment though. I love that car and I will drive it till the wheels fall off. But my point is our profit margins in veterinary medicine are extremely low. And we have to be very, very cautious with how we spend our funds. And I have, to be really transparent, I have a lot of nerves about we're getting ready to move into a brand new building. And I'm really anxious that a lot of clients are going to start making comments like, I guess you're charging this much so you can pay for your brand new fancy building. Not that I haven't already heard those comments before, because I have. But those things hurt deep to people. We're just people. And to be really, again, transparent, we didn't take on more debt by rebuilding this building. We had a great insurance provider who was there when we needed them out of a circumstance that we had no control over. And so, our building will be new, but we did not increase our debt load with it so that we are not passing on expenses to the client. And so, my hope is that just this information helps the general public be more aware of the battle on our side of the exam room table and what we're facing, because we want the best for you. We want the best for your pet. We want our staff to be, also able to make living wages and, feel like they're doing a positive impact in our community. I mean, all those things are important to us. So we're just hoping that when we meet you in the middle, you're meeting us in the middle too.
Yeah. And I guess what I challenge all with as clients and as owners and caregivers to your pets, bring those concerns to us. I mean, when you're in the room, just be like, hey, this is what I'm working with, because I'm a budgeter. Yeah. And I get that. And then just be like, hey, this is what I'm working with. And I'll be like, great.
It is so helpful to us.
When I get told that, I go, yes. I know what I can do then. And I'll just be like, bam, this is what we're working with. Let's do it.
Yeah. And we would 100% rather you bring those things up right away, even before we've even done anything, than call us back a week later and tell us that you were upset that you had to buy an expensive antibiotic. Because if we had known in that moment that it wasn't something you were comfortable with, we could have been like, okay, well, here's another option. We can do this. This is the trade-off. Here's the con. The pro would be that it is cheaper. The downside is that there's, a 20% higher likelihood we're going to have to extend that antibiotic or whatever the case may be. So at least you are able to make that decision risk analysis for yourself. So we have no problems at all. I mean, just like that puppy that came in, he said, here's how many dollars I had to spend on this. What can we do? And I was like, yep, now that I know what I'm working with, I'm going to start working my way down this path with you. And that's going really, really well.
And I had a parvo puppy on Saturday that, I went over, I made like 3 or 4 estimates and I was like, here's what we can do. And I was like, here's why I think you should, because financially she was like, we cannot hospitalize. And I was like, that is fine. We're going to get through this. I was like, but we do have this new drug that's a monoclonal antibody for parvo puppies. And it is pretty freaking amazing.
It really is. It's game changer.
Revolutionizing, game changer, definitely for the outpatient parvo puppies. Yeah. So the ones that are going home. And I was like, if you can just spread it to get to that, I think that we have a good chance. And that puppy's doing amazing.
Yeah. And was able to avoid hospitalization. Because you can still always say, and if we're not doing well in 48 hours, maybe we can, pick up where we left off if we have to.
She caught it early, which parvo is tricky because you.
Oh, yeah. It's such
it gets worse before it gets better.
Nasty little.
But with the monoclonal antibody, that puppy's been doing great. So.
Yeah. So just being upfront with us, and I'll still take it 2 weeks later. If you're like, man, I just still don't feel at peace about this. I feel like I wish I'd have had this experience be different. I still value that feedback so much. It's just I'm a little more limited on what I can do to resolve it. And the worst case scenario is that you just don't say anything. And then we are aware of your, situation. And that's the last thing we want. And my hope is that now you are more aware of our situation so you can be more transparent with us as well. Because really trust and communication is all that we have here on this planet to try to figure out how to work together. And so that's really what we're aiming to provide to you, even if we fall short, and what we're hoping to receive in return.
Yep.
So anyway, yay for having all of our wonderful clients and for choosing us. If you aren't our client because you live somewhere far away or, whatever the thing is, I'm glad you have
My cousin listens in Florida.
That's so fun. I love that. I actually have seen, we have like 7 different countries. People in 7 different countries have listened to the podcast, which is super interesting to me.
She texted me and she was like, I'm listening to your podcast.
Yeah.
Her dog was diagnosed with Addison's and she was texting me about it. And I was like, check for Addison's.
That's so funny.
They did. And it was
it's so rare too.
It's so rare.
But anyway, yeah. So, and I feel like this information can be helpful to you no matter where you're at. Cause I know that we are not the only clinic that's juggling these very same things. And, wherever you may be, whatever client you may be at a different veterinary hospital, I'm sure you've had these thoughts too. And so hopefully this just allows us to be, again, more transparent and more compassionate with each other. And just that open line of communication is everything.
Yep.
Yeah.
Also, it's my aunt, not my cousin. Guys, I'm tired. I did not sleep last night.
The funny part about it is that only this aunt/cousin would have known he was wrong, but he knew he was wrong.
He's going to listen.
So
I would have to text her.
He has to correct himself every time. Anyway, okay. All right. We've got to go see some other rooms, but if you guys,
I said I need to take a nap, but that's not going to happen.
Yeah. I mean, not until after 6 p.m. And then we'll call it a nap. All right. We're going to sign off. Y'all have a good one. Bye.